Thank you and welcome to this short presentation on using medicines effectively. This is a third in the Severe Headache Expert series. My name is Raeburn Forbes and I'm a practicing neurologist who looks after people with difficult to control headaches. Medication for headaches comes in two different forms. There are medics for prevention or prophylaxis, and there's acute or rescue medicines. It's important that you understand the difference. Prevention or prophylaxis medicines are required if you're getting 2 or more disabling headaches a week, and that you're not overusing painkillers, and that you've taken lifestyle steps. Steps 1 and 2 of the Severe Headache Expert series cover overuse of painkillers and headache-friendly lifestyle. The key to prevention is to start the prevention tablet at a low dose. Build the dose up on a weekly basis until you reach a maximum tolerated dose, or you reach the maximum dose that you are allowed. You then must persevere with the maximum dose tolerated. It usually takes between 8 and 12 weeks for the effect of a prevention medicine to occur. The most common mistake people make with prevention medicine is to give up too early, because until you get to that 8 to 12 week time zone, you're going to have some headaches along the way. An example might be a drug called amitriptyline. I would often start this at 10 milligrams once a day. I would increase the dose by 10 milligrams a week until you get on to the maximum you can tolerate, or a maximum of 50 milligrams daily. I usually find that younger people can rarely tolerate more than about 10 or 20 milligrams. You then stick with the maximum dose you can tolerate, which might only be 10 milligrams, for a minimum of 8 weeks. This should reduce the amount of migraine headache you experience by between 30 and 50%. So your dose might be 10 or 20 or 30 or 40 or 50. But the key thing is that you get a dose that you can tolerate and stick with it, and do not give up. You can read more at the headache prophylaxis page. Next is the acute or rescue headache treatment. The website has a page that shows you how to put together a headache rescue plan. It's best to think of acute pain treatment as a ladder, where you start with the mildest and gentlest painkillers and you increase to stronger and stronger treatments. We would normally start with paracetamol or aspirin or ibuprofen for a simple headache. If that doesn't seem to work, adding in an anti-sickness or antiemetic drug can be helpful, and these can be used in combination. If a headache or 2 headaches do not respond to a mixture of paracetamol and an antiemetic, you're really looking at using a triptan drug. Triptan drugs are specific anti-migraine drugs, and sumatriptan is the one that I would use most often. After that, you're looking at suppositories of anti-inflammatories and anti-sickness drugs, especially if you've got a lot of vomiting with your headache. If after that you're still having a bad headache and you're reaching the time of day when it's your normal bedtime, inducing sleep with a sedative like diazepam can be useful. I would tend to think of an acute headache as a 24-hour period where you've got to hit your headache fairly hard. Again, it's still very important that you try not to overuse painkillers and that you take steps to adopt a headache-friendly lifestyle. So what should you do? You need to be patient if you're using prevention medicines, and go to the website and, even with the help of your own family doctor, draw up an acute headache rescue plan. The next video in the series looks at drug-free treatments. If you want to keep up to date, there's a monthly newsletter, or you can look for postings on Google+ or Facebook.